I'm Mark. I'll be going over your Respironics Dreamstation today. First thing we'll do is we'll go over a quick overview of your machine, how to turn it on and off, some of the settings on there. Then we'll talk about a little bit more in depth about your humidity. Then we'll talk about some menus and some things you can change in there to make things more comfortable for you. Then we'll talk about cleaning and maintenance on your machine. First things first, to turn your machine on, the pressure, all you've got to do is press this big rectangular button on top just once. When you do that, and I'm covering the tube here so it's kind of quiet, but you'll see your prescribed pressure come up here. Off to your right hand side, there's two humidity settings, which we'll talk about in just a minute. But to turn your machine off, also you do have your ramp button right here. What your ramp is designed to do is it's going to drop the pressure to a pressure that you feel is more comfortable, and then gradually work up to your prescribed pressure over a time that you choose. And we'll talk about that in just a minute. But once turns your machine off, your tube connects right here. This is a heated tube. You can see two different sides. Heated tube just connects in here. Your water, you'll want to fill up each night. And if you pull this, that will pop up. It's spring loaded. This comes out, fill it up to the maximum line, and you want to use distilled water in there, just so it doesn't crust up. Again, we'll talk about that in just a bit. It goes in there. So ultimately, start, stop, and it does all the rest. Next thing we'll go over is a little bit with the humidity settings, and feel free again to follow along with your own machine. You can't harm anything or hurt anything with the settings. But I'm going to turn the pressure on here again, and as I mentioned, your humidity settings pop up there. And the bottom one is percentage of relative humidity. The top one is the tube temperature. And I'll show you how to change both and when to change. So you'll notice to change either one of these settings, after I've turned the pressure on, I just twist it either down or up, depending on which one I want to change. Push it to unlock it, change it, lock it back in. And you'll notice I've just gone up to the maximum on the bottom there. Now, when you'd want to change these, typically what I'll tell people is increase the bottom one. So from like a 3 or a 4 to a 5. If you're getting dry, stuffed up, runny nose, you're increasing the percentage of relative humidity here. If you max that out at 5 right there, then start increasing the tube temperature. A lot of us think of dry air or warm air as being dry air, but it's just the opposite. The warmer the air is, the more humidity it holds. So in this case, I'm going to twist it up there, click on it, and go up to 4. I can't see very well there. There we go. So I've almost got my humidity as high as it'll go. 5 and 5 is the max there. Just the opposite, if it's too warm and too swampy for you, decrease the humidity or the tube temperature first. And you can go clear down to 1 or a 0 on it. Just know if you do get below 1 to a 0, essentially your humidifier is turned off because it disables it. But again, increase your bottom one to get a little bit more humidity, and then if it's too warm, too swampy, decrease your tube temperature. But just remember, the cooler the air, the more humidity the cooler the air, the more humidity you're losing. So the warmer the air, the more humidity it holds. And then again, I'm going to turn it off. Next part that I'll go through with you are the menus, and they can be very in-depth. Most of them are informational. Now, you don't have to know this. And there's also an app that you can get for the Dreamstation, which I actually really like. It's the Dreammapper App, and it wraps a lot of these up all in a nice little package that you can go through each day and tells you what you're seeing. Kind of start going through the menus here. You'll notice if I twist the large dial, it's going to scroll through each one of these menus. Under the info menu, if you click on it, it's going to start off with your therapy hours. Next one over is your AHI. That's how many times you stop breathing an hour. Typically, we want to get that lower than 5 is what the doctor's goal is going to be. Sometimes it may take some pressure changes to get there, and you'll work through that with your doctor. And typically you'll have a follow-up with them, and they'll get that changed if the pressures aren't where they need to be to get that low enough. But less than 5 is treated. Next one over is mask fit. We're looking for 100% on the mask fit. Next one after that is periodic breathing. For most people, I tell them to typically ignore this. The times where you may want to kind of pay attention to it is if you get up above double digits percentage. A lot of times I'll just have a 1% on here. It's just looking for patterns of breathing that may be helpful to your doctor. Your 90th percentile pressure. If you're in an auto set mode, which most patients are now, this is going to tell you what pressure gets rid of 90% of your respiratory events. This talks a little bit about your app. For the Philips machine, it's the Dreammapper app. It is handy. It gets all of that data into a kind of a nice little wrapped up neat package that you can look at every day. So this is the last screen of the Dreammapper app. And then to get back out, if you twist it, you'll see this big arrow, and that's the way you navigate through all the menus here. So if you click on the dial button, it's going to get you back out. Next one over is preheat. The advantage of this is it's going to, it will open your sinuses up a little bit more if you do have a little bit more humidity. So if you're dealing with any congestion, any allergies, it's very helpful to use. To activate it, just press the dial button. You'll notice it unlocks there, and then I'm just going to give it a twist, and it should say on, and click on it, and then it's heating. If you haven't turned the pressure on after 20 minutes of preheating, it automatically shuts off. Now you don't have to use this function. If you just press the start button, your humidifier is functioning all the time that your pressure is on. So it is just an optional thing to do. And most people don't end up doing it, but it is an option that helps with congestion. And again, if you want to turn it off, click it. Click it again. Or you can just wait for 20 minutes and it automatically shuts off. Next one over is My Provider. There's not typically a lot in here. You get software versions, serial numbers, things like that. But there is one handy thing that can help. So again, just like all the others, you twist it, it's going to highlight, push it to unlock to get inside. You'll notice the first little bit talks a little bit about your device. Next one over, this is the handy piece. You'll notice it says send receive. So if your doctor changes your prescription, what will happen is I'll usually send it out over the internet. And if you want, you can wait for 24 hours for that to update. If you want to get it faster than that, you just go here, click on upload. And this is going to give us a big X because it's not connected to anything, but you would get a big green check mark there, and then your prescription's updated immediately. If you don't, what will happen is, again, about an hour after you take your mask off, then the following day it will update. So it'll eventually get there. But this just gets that updated faster. I'm going to kind of click to get out of it. And then I'm going to scroll through. There's a performance check, which you won't necessarily need. And then also the main menu, as you saw before, you just kind of highlight it. It's got the arrow. Click on it, and you'll get out. Next one over is My Setup. There's a few different things you can change in here. The first one is your ramp setting. What your ramp setting is, it's designed as a comfort setting to use. So essentially what it's going to do is, and for right now we have a prescribed pressure of 6 on here. I just changed that up. If you want to go from a pressure of 4 to 6 over a certain amount of time, like let's say 10 minutes, let's say it takes you 10 minutes to fall asleep, but the pressure on 6 feels a little too strong and you want to start at 4 and gradually work up to the 6. That's what your ramp setting's for. So this is a setting for you and to get you comfortable and hopefully to help you fall asleep. You don't have to use this setting if you don't want to. To activate the setting, you just press the button there. But the settings, the first little piece we'll see in here under my setup, click to go in it. Right now we're set at a 4. But if I were to press the start button, it's going to be a 6. And I'll show you how this works in just a second. Now to change these, you can scroll up. You can go clear up to 6 on there. 6 kind of deactivates it, but you can go anywhere. So I'm just putting it at a 4 and a 5, or a 4.5. And then the next time, the ramp time is how long it takes to go from 4.5 to 6. So let me give you an example. When I start the pressure, we see 6 there, and we set our ramp time to 10 minutes. So I'm going to press this button. You'll see when I do press the button, it drops to 4.5. And then over a period of 10 minutes, it's going to work from a 4.5 to 6 to help you fall asleep. I'll just turn it off there, and we'll go back into that menu, the My Setup menu. And again, that's what that ramp setting's for. Feel free to change that to what's comfortable to you. And again, your ramp time. Next one over is your flex setting. Sometimes this will be activated, sometimes it won't, just depending on what your doctor has prescribed. But a lot of times what the flex setting does is when you exhale, the flex setting will dip. So if you're on a pressure of 6, when you exhale, the pressure will dip a little bit lower than the 6 to make it a little bit more natural. Sometimes on a flex setting at lower settings, your airway will close off a little bit. So some doctors will prescribe a flex setting, some won't. A lot of times we may see that inactive, just like off. But there are flex settings on here. You'll notice if I click on it, I can go anywhere from a 1 to a 3. 1 is the lowest dip in pressure. So if you want just a slight dip in pressure, you'd want 1. A medium dip is 2, and a very deep dip in pressure would be 3. So 3 would give you the greatest amount of pressure relief on there. Next one over is the humidification type. And all this is it's telling you it's the heated tube type right now. If I take the heated tube off, you'll notice it changes, but it's locked in. So not a lot to do there. Next one over after that is your mask type. Typically on your masks, most masks on the market are a type 1. So usually that will be preset by your clinician. But it'll be a 1 through a 5, but typically it'll be preset by your clinician. But most masks are going to be a 1 setting. Next one over again, very similar to the humidification type is your tube type. It's locked in. It's a 15 millimeter heated tube. Not much to do there. Next one over after that is your language. Basically your options are either English or Spanish. Next part over is the mask fit check. The advantage of the mask fit check is there's a couple of advantages. For men with facial hair, it helps to let you know if the mask is sealed up or not. So sometimes facial hair causes leaks that you can't necessarily hear or feel. The other advantage is if you're on a very high range auto set, so let's say the pressure is going from a 5 to possibly a 20. At a 5, you won't need that mask very snug, but as the pressures go up, you'll need to really snug that mask down, but it's typically going to start leaking at you as it gets into the higher ranges of pressure. So to avoid those leaks, what you can do is run the mask fit function. It gives you a bit of a blast for a few seconds at your higher pressures. So right now I'm going to click on it, and it's going to tell us how well we're sealed up. You can see there's a green, it's up in the green piece. If I let my hand off there, it's telling me we need to adjust. I plug it back up so we've got a better seal now, and we're back up into the green. To stop the mask fit function, you just click there and it rolls into your therapy automatically. And again, I'm going to turn it back off. So the mask fit function is a good thing to use for men with facial hair and people with a high range of auto set. After mask fit function, we've got your modem. Your modem is this little piece on the side. It's going to call out every day, and that will get the data to your healthcare provider, us in this case, but also your doctor. And you can turn that off, but typically we want to have that left on. That allows us to troubleshoot any data or any mask fit issues or pressure issues, and it allows your doctor to track how your therapy is going. Next one over is Bluetooth. This is pretty simple. It's just your Bluetooth is either on or off. This is typically for the app. If you're using the Dreammapper app, you would just Bluetooth it to your machine. I actually do recommend the Bluetooth function because it's a little bit faster than the internet function. The last slide is the time. You'll notice you can change that time there if you have daylight savings time, which I think we're coming up on. Just change that there. Click it, change it, and go back. And then the next one, of course, is your escape arrow to get back to the main menu. If you just click on it, it's going to get you back out. That's really it for the menus in there. There's a lot to look at. Not a ton to change. You can change those little things in there if you'd like, but not a lot on it. Really, again, just your start and stop to have your machine function. Next part we'll do is we'll go over your cleaning and maintenance on it. So this piece will open up. If you lift this up, you'll have your filters. If you grab and pull, this will pop out. I'd recommend rinsing this filter out, and I'd rinse it out probably about every 2 weeks. This piece is your disposable filter. In this one, I would check every 2 weeks. This is going to catch most of the big dust particles. This one's going to catch the fine particles. So again, we're just getting rid of the dust when we rinse that out. And then if this is starting to look dark, dirty, throw it away, put a new one on there. We should send you home with a few of them, so you should have access to more of them, but just do that every 2 weeks. The filters are separated just like that, and I'm just using kind of a aftermarket filter here, but it will just go together. The top filter is going to sit in a groove in the bottom, as you can kind of see there. And then it's spring-loaded right here on each side, if you can see that. And it's just going to go right in there. You'll know it's in there if that door goes all the way down, and will just snap in place. Really? Next part is the humidifier. So if you pull this, it's spring-loaded, and then grab this and lift, that will pop up. You'll notice it just sits in here. The outer piece kind of points away. There's only one way it goes in there. If you get it in the wrong way, it won't close. But this will come out, and as you can see, there's a fill line here. You want to fill that up with, as I mentioned before, distilled water. Regular water will crust this up. If you have to use regular water in it for a night or two, you definitely can if you have no other option. Afterwards, do a 50-50 water vinegar solution, so half water, half vinegar. Soak it in there and it breaks up any water deposits when you're ready to use distilled water again. But fill it up to that maximum line. If you'll notice you've gone too far, because water will come out of that tube if you do fill it up too far. Just going to sit in there, and you'll notice it comes down. You've got to give it a little extra pressure right here, and it will snap in place. I would also recommend washing this out once a week, warm soapy water. This is dishwasher safe. And then on a daily basis, the manufacturer recommends to empty it out every day and just let it air dry, and also leave that open to dry. The tubing, you'll notice, as I mentioned, just connects right here. If you squeeze right there, that will pop out. I'd recommend washing the tube out once a week with warm soapy water. I've found that these fit very well on bathroom sink faucets. So usually what I'll do is squeeze a little dish soap in there, hook it up to the faucet, hold it while it's there, otherwise it'll make a mess. But turn the faucet on and let the water pressure run it through the tube. And then I kind of hang it on. We have glass around our shower, and I just hang it on the glass. You can get that electrical connection wet. Just make sure it air dries before you plug it in. It'll just snap in like that. That's typically the cleaning for the Dreamstation. You'll also get a handwritten just list of daily, weekly, monthly things to do with your CPAP from our checkout, from our customer service rep.